Hey guys, my name is Dr. Ari All. I am a psychiatrist in Boulder, Colorado, and today we are going to be talking about microdosing psilocybin, what the research says, what the potential benefits are, and what the potential harms are. I live in Colorado and we just passed a bill called Prop 122. I've had a lot of patients ask me about what this actually means. In essence, it means two things. First, it means that psilocybin is decriminalized, which means that it's still illegal, but they're not going to arrest you for it and no one really cares if you do it or not. The second thing it does is set up a board of natural medicine, which will eventually allow practitioners like me to use these medicines carefully in office. There is a lot of research that has come out on using full doses of psilocybin for depression in the last 10 years, but there's not that much research on the effects of microdosing psilocybin and what effects that has on your mood or mental health. Microdosing is the use of psychedelics in very small dosages, usually 1/10 to 1/30th of a regular dose. With psilocybin, that means about 100 to 300 milligrams. There's a lot of anecdotal information about microdosing psilocybin that has come out in the last couple of years, mostly from Silicon Valley, where they use it for cognitive enhancement and work performance. Today, we're going to be focusing mostly on what effect microdosing has on your mental health. Specifically, I'm going to be talking about microdosing psilocybin. Most studies to date on microdosing have been observational studies, which means that the people in these studies had already been microdosing before the start of the study. Other studies showed that surveyed microdosers had an increase in performance as well as cognitive function. However, there are many problems with these types of studies. For instance, a lot of people in these studies used supplements such as lion's mane or niacin. There's also some technical issues with these studies. For instance, they didn't use an active placebo or randomize people between groups. This means that we don't know if microdosers are just naturally more happy or creative, or if it's actually the microdosing that is giving them these traits. A more recent study in Nature, also by Joseph Rootman et al., tried to sort some of this out. This study followed 952 microdosers and 100 non-microdosers over the course of 30 days to see what effect the microdosing had on mood and cognitive performance. Since the study included over 1,000 people, they were able to look much closer at the effects of psilocybin. They found that the most common dose of psilocybin used was between 100 and 300 milligrams, 3 to 5 times per week. They also found that taking cognitive enhancers like lion's mane or niacin did not have an effect on the psilocybin. Lion's mane is a supplement with some preliminary research on cognitive enhancement that has been used as an adjunct for psilocybin. Niacin, also known as vitamin B3, is involved in energy and protein metabolism. Neither of these, when combined with psilocybin, had any increase in the effects in mood or cognitive function. What they did find was that microdosing psilocybin appears to decrease depression, anxiety, and stress. It also appears to increase cognitive performance. Basically, the way they measured cognitive performance was by tracking how quickly people could respond to a changing stimulus on a screen. These effects were found to be stable between people with mental illness and without mental illness. They were also found to be stable across gender and age. Another interesting study that came out by Matthew Lies et al. In the journal Pain found that psilocybin may decrease chronic pain. This was a series of case studies, so it's not as robust as a randomized controlled trial, but there is some preliminary evidence. So what does this all mean? Well, it means that psilocybin may decrease depression, stress, and anxiety. It may increase cognitive performance, and there is some empirical evidence that it may decrease chronic pain. But again, these studies had no control group and no active placebo, which makes conclusions very difficult. We also know very little about the side effects, which gives me caution. For instance, full doses of psilocybin have been found to potentiate psychotic and manic episodes, particularly in people who have a family history of psychosis or a history of schizophrenia. There's also not that much information on the physical side effects of microdosing, so we still have a lot to learn. I cannot recommend to anyone watching this video that you take a microdose. This is for informational purposes only. This is not medical advice, and this does not constitute a patient-doctor relationship. However, I hope this helps people to know exactly what the data says and does not say. If you're interested in more of these topics, you can subscribe below. I would also like to hear what research you guys have found on microdosing. Thank you for watching this video.